So, Jerica also has a little bit of issues with the knee and the ankle after a pretty bad ankle sprain. When the ankle gets sprained pretty heavily on an inversion or eversion sprain like this, we can see that this ligament gets pulled. Oftentimes this one up here is missed, and we'll see some instability in the ligament around the knee. And so if we muscle test the hip, can I see your hip? Just bring this knee up, bring the knee up a little bit, and keep your foot there, don't let me pull out. Okay, keep it there. We can see that there's a little bit of weakness in the hip. Now, this can be diagnostic as well as supportive, so therapeutic. When we tape the lateral collateral ligament in the fibular head, oftentimes we can see a good recruitment pattern in the hip. Can you straighten your knee just a little bit? So I typically like to tape the knee in kind of a slightly flexed position, like so. We're about maybe 20 degrees of flexion. And I'm going to come down to the lateral knee to connect with the tib anterior right there. And we're going to go up the lateral side of the knee. Right here. And now the lateral collateral ligament is supported, and we see the fibular head supported as well. Now let's check that hip again. Okay? Keep it there. Resist. And one more time. So we see that the hip is now stronger because the knee, your brain can understand where the knee is at from the ligament injury, from the ankle sprain. It's more of a complex pattern, but a lot of times it gets missed. And so now when we tape the ankle, we want to give lateral ankle stability here, but I also want to give some medial ankle support here so that the brain can understand how the ankle is stabilizing itself. So when we do the ankle, we're going to do an ankle lock. Okay. So when we do an ankle lock, depending on how the ankle was sprained, this was sprained this way, so we are going to support it this way. We are going to start at the medial ankle, probably about 2 inches above the malleolus, and then wrap underneath the ankle to the outside and up the side of the other malleolus. Now this is a solid ankle lock, and this should give a fair amount of stability to this leg now. Okay? How does that feel, Jerica?
Feels good.
Good?
Yeah.
Okay, now let's double check that hip again and see if you're even stronger. Keep it.
Nice.
It doesn't feel like you have to hardly
No.
try, right?
Yeah.
So you're making better connection with your body.
Cool.
Excellent. Thank you, Jerica.
No problem.